Now let's look at South Korea, the land of K-pop, K-dramas, and now a medical crisis. South Korea's trainee doctors are on strike. There are about 12,000 who are protesting. The strike has now entered its fourth week and there's no end in sight. In fact, it may get worse. Now, medical college professors are threatening to quit. They say they will step down if their striking trainees are punished. It puts the government in a tough spot. Seoul has begun suspending medical licenses. So if it goes through with this punishment, the crisis could escalate. The government has already brought in the military. They've asked military physicians to cover for the striking doctors. But how sustainable is this solution? Here's our report.
South Korea is facing a medical crisis. 93% of its medical trainees are on strike. Almost 12,000 trainee doctors haven't been showing up for work. The doctors are protesting against a government initiative. Seoul wants to increase the intake of medical students. The South Korean government believes that there will be a doctor shortage soon because the country is rapidly aging. Therefore, more healthcare professionals will be required in the years to come. So the government wants to increase the number of doctors in the country by increasing the student intake. They want 2,000 more students every year starting from 2025. But the current trainee doctors believe that this is unfair. They think more students will lower the quality of medical education. They also think the additional doctors will lead to a reduction in pay because of more competition in the market. South Korea's trainee doctors want the government to raise their wages first. And that is what has led to the present standoff. The doctors' strike has entered its fourth week, and it's starting to take a toll on the country's healthcare system. Surgeries have been cancelled, wait times have been increased, and treatments have been delayed. To provide support to its hospitals, South Korea's government has now turned to the military. Yesterday, it deployed 20 military surgeons and 138 public health doctors. They've been sent to 20 hospitals across the country for an initial period of 4 weeks. More military personnel may be deployed soon. Military hospitals have also been opened up to the general public, and nurses have been given permission to perform some medical procedures reserved for doctors. But these are stopgap measures at best, because South Korea is short by 12,000 medical professionals at the moment, and more may be on their way out.
어제 서울의대 교수협의회
There was a media report on Seoul National University Medical Professors Emergency Committee resolution to submit resignations en masse. I deeply regret and want to express deep concern over the decision as it poses serious threats on patients' lives and health. The professors must work with the government to urge trainee doctors return to hospitals.
진료를 거부한 전공의들이 환자 곁으로 돌아오도록 지혜를 모아야 할 것입니다.
Medical professors are standing by their pupils. They say that if the trainee doctors are punished, they will resign. Seoul has already threatened the striking doctors with punitive action. The government said it would revoke their medical licenses. The process has begun. About 5,000 doctors have received suspension notices. More notices are expected to follow. This is a pressure tactic. The government also promised leniency to doctors who return to work. But it seems the plan backfired. Today, professors from 33 of South Korea's 40 medical colleges passed a resolution. They have threatened collective action, which has left the government scrambling again. No trainee doctors is bad enough. No medical professors would be a disaster. It's now a game of who blinks first, the government or the doctors. And all this while lives hang in the balance. Ordinary South Koreans are suffering. So for their sake, this standoff needs to end, and cooler heads need to prevail.